Hello, everyone, and welcome to our Pharmacy Practice Research Virtual Summer Meeting. My name is Victoria Cardenas, and I'm the chair of the Pharmacy Practice Research Special Interest Group of FIP. Today, we are hosting a session organized by the Pharmacy Practice Research Special Interest Group, which aims to align with our objectives. Next slide, please. As you can see on the slide, the PPR SIG has different objectives, including the dissemination of information at an international level across pharmacy practice researchers to increase the quality and quantity of pharmacy practice research and to establish networks and enabling collaboration on major themes for experienced researchers and higher degree students. Next slide, please. How do we fit within FIP? The PPR SIG is included in the Board of Pharmaceutical Sciences of FIP, or BPS, which deals with FIP's scientific activities with the ultimate objective of contributing to the improvement of world health, mainly through disease prevention and treatment strategies. As you can see on the slide, the BPS has 6 different SIGs, one of which is the pharmacy practice research. Next slide, please. You can engage with us through different activities, so all individual FIP members can choose to be a member of the SIGs, through which they can interact with different colleagues with same research interests. Particularly with the PPR SIG, you can interact with us through our regular events that we organize either virtually or face-to-face, and also through our Facebook group, as you can see on the slide, where different researchers across the world share different news and research on pharmacy practice. We are also happy to announce that our next face-to-face meeting will be held in Copenhagen right before the FIP World Congress in 2025. Next slide, please. For today, we have a very interesting program. We have 7 different speakers who will be sharing their research from all over the world on different topics related to pharmacy practice research. We have a coffee break in the middle, and you can take that time to have coffee, but also to see our e-posters. Next slide, please. Next slide, please. We received more than 70 posters, which are available online. To access those posters, you can either choose to go to our website. Next slide, please. Go to our event website and you click on e-posters and you will see all the posters available there. Click on them, you can see the corresponding author and the abstract. It is very interesting to note that you can find the details of the corresponding author. So if you share common research interests, please feel free to get in contact with the different researchers. Next slide, please. You can also access the e-posters through the app. Next slide, please. You can see 2 QR codes on the slide, depending on the use of Android or Apple. Just scan the QR code and it will take you to the app. Make sure you are downloading the app with the logo on the screen, and you will be required to enter a code, which is PPR SIG 2024 VIR. Next slide, please. So I will give the floor today to Fernanda Tonin, who is our vice chair and who will be moderating the session for today. Just before we start, as a reminder, this event will be live streamed and also certificates of attendance will be provided by early next week. Thank you very much. I hope you enjoy the session, and thank you, Fernanda, for moderating the session.
Thank you, Victoria, and welcome everyone to our second day of the PPR SIG virtual meeting 2024. I'm really excited to be here and to moderate this event. As you can see on our schedule today, we have 6 presentations from all across the globe on different topics on pharmacy practice research. Before we start, I would like to thank our organizing committee, represented here by our chairs, Victoria and Charlotte, and also the FIP team for supporting us for this event to happen. So thank you very much, everyone. And I also would like to remember you that the posters are available online, as Victoria said, and you can check them during our coffee break and also in the next day. So feel free to reach out the authors and network or communicate about similar topics or interesting research. Also, I'd like to remind you that you can ask questions to our speakers of today in our Q&A box. And after each presentation, we'll try to discuss some of those questions. Otherwise, the authors, the speakers can, after that, respond to individual questions. Okay? So our first presenter of the day is Anastasia. Anastasia is a student of Pharmaceutical Faculty Rund University in Russia, and her research interests are related to pharmacy management in economics and also gamification in education. So welcome, Anastasia. The floor is yours.
Thank you. Hello, everyone. I would like to thank you for presenting my short bio. And in this presentation, I will walk you through the concept of gamification as a method to increase pharmacy student engagement and motivation in preparation for the pharmacist license exam in Russia. Before we begin, I want to confirm to participants that I have no conflict of interest to declare. Thank you. Kevin Verbeck and Dan Hunter, the pioneers of gamification, define it as the application of game attributes and mechanics in non-game context. Its educational use is increasing. In higher education, the uptake of gamification has been most common in health professional education, offering the ability to provide authentic, situated learning without risk of harm to patients. Gaming elements might include the game's story, scoring, competitions, and consequences. Gamification can make non-game tasks more interesting and enhance participant motivation, engagement, and value creation. Gamification takes a person from an adult state to a child state when we all learn by playing. There is less resistance to the educational material. And if you agree that it's easier to learn by playing, give a reaction in Zoom. Our study explores the
Anastasia,
potential.
sorry to interrupt you. Could you please speak a little bit louder?
Yeah.
Yeah, sorry. Yeah.
Our study explores the potential of incorporating game elements into the training of students preparing for the pharmacist license exam. In Russia, pharmacists often serve as a primary medical advisor. Research indicates that 61% of Russians rely on pharmacists' recommendations when choosing over-the-counter medications. It's crucial for pharmacists to provide accurate information about medications, dosages, and application methods. Additionally, Russian professional standards mandate that pharmacists inform the public and medical professionals about available medications. And in this regard, all pharmacists must pass a professional exam. Passing the exam requires demonstrating practical skills in simulated conditions across 5 different stations, and one of the exam stations is pharmaceutical consulting. At the consulting station, students enter a simulated pharmacy and act as pharmacy employees. They are presented with a list of medications and their mock-ups. Students must help a customer choose an appropriate medication. This involves determining which medications require a prescription, identifying the patient's health issues, and offering suitable over-the-counter options or prescriptions alternatives. During the gamified simulations, students assumed the role of autonomous pharmacists in all decision-making, actions, and communication. This provided an opportunity for active learning in an interactive environment. Next slide, please. International studies on the use of gamification in education show that simulation games are particularly effective. Creating a pharmacy simulator with gamification elements can help students practice realistic scenarios, improve decision making, and develop consulting skills in an engaging way. These simulations will enable pharmacists to transfer their skills from the game environment to real-life simulations and exams more easily. Currently, there are no training simulators at the pharmacy for students in Russia, but successful examples exist abroad. Uh, for example, SimFarm, a web platform from the University of New Zealand, allows students to role play as clinical pharmacists in a hospital setting. Pharmacy simulator developed by Dr. Beindorf at the University of Tasmania provides a simulated learning environment with instant feedback and customizable scenarios. The next slide please. And Yukai Choi developed the Octalysis framework, which consists of 8 core principles that influence human behavior and engagement in learning activities. We will explore these principles in the context of educating future pharmaceutical professionals. And the first is the epic meaning. Create a game scenario where pharmacists feel their work contributes to public health, such as developing and distributing a new medication during an epidemic. Development and accomplishment, implement a scoring system and level up opportunities to reflect progress. Feedback, provide instant feedback on the correctness of consultations and decisions. Ownership, allow pharmacists to collect virtual rewards and manage a virtual pharmacy. Social influence and relatedness, introduce competition among pharmacy and in-game chat for discussions and experience sharing. Curiosity and impatience tolerance, create time constraints to simulate real-life urgency. And unpredictability, curiosity include weekly puzzles or unconventional tasks related to pharmaceutical consulting. Loss and avoidance, implement consequences for incorrect decisions to emphasize the importance of accuracy. The next slide, please. And play the video, please. Thank you. We are currently developing an educational simulator using JavaScript in collaboration with the programming student from Rudan University too. Video demonstrates the main mechanics of the game. So far, we have created one game scenario where a customer seeks an over-the-counter medication for abdominal spasms, and the simulators include shelves with medication with choice and a computer with electronic medical instructions, simulating real pharmacy exam. The next slide, please. Future plans include creating interactive scenarios that take into account features of the pharmacy license exam, situations where you need to consult on symptoms, situations where it's necessary to dispense medicines according to a prescription, situations where the visitor asks to dispense a prescription medicine, without a prescription, and an over-the-counter medicine needs to be recommended. 8, physiological characteristics and whether the patient is taking other medication. We also need to connect the game to an online platform for students' access, establishing a database to track student progress, and improving the game's UX UI for a user-friendly experience. Testing for functionality, bugs, and design issues will be essential. We also plan to enable feedback when choosing the wrong replica. Developing an educational game presents challenges and such as the balancing educational content with entertainment, adjusting difficulty levels, personalizing the experience, choosing the appropriate platform, evaluating students' performance, and motivating participation. The next slide, please. I'd like to end with a brief conclusion. Gamification as an innovative educational approach can significantly enhance the learning process for students and will allow them to meet pharmacy accreditation standards. Thank you all for listening. It was a pleasure being here today. If you have any questions, I will be happy to try to find answer to them. Thank you.
Thank you very much, Anastasia. Very enlightening presentation. And of course, in a hot topic, gamification is indeed something that we are trying to expand in different fields, including in pharmacy practice research. So while we wait for further questions, please, you can add them on the Q&A box. I would like to question you, Anastasia, about the octalysis framework. So how do you choose that, or why did you choose this framework? And by JavaScript, okay. And do you know if there's others that could be used?
Okay, we have chosen with another student JavaScript because JavaScript is a language of programmers where you can do a lot of functions for dialogue training.
Yeah, but you could choose others, or this is the most common one?
Yeah.
Yeah. Okay, so we have a question here from Aslam. The question is, would you like to explain the difference by, for instance, ramification and experience training in pharmacy?
Repeat, please.
This is in the Q&A box. So the question is, would you like to explain the difference from ramification and experience training in pharmacy?
In pharmacy.
Yeah.
Okay, gamification in pharmacy might include epic meaning or virtual rewards in a virtual pharmacy, or for example, time constraints to simulate real life urgency, for example.
And another question would be related to how many people or which kind of multidisciplinary team do you have to build this kind of gamification programs and analysis?
Two people.
Just two?
Yes, me and programmist students.
Wow, that's amazing. I thought it would be like a crowd of people, like 6, 7 statistics and developers and everything. Wow, fantastic. So really great work. Best of luck in the future projects.
Thank you.
If we have further questions, you can check them on the Q&A box during the next presentations, okay?
Okay, thank you so much.
Thank you. So we can move on to our next presenter, Katerina. So Katerina has over 24 years of experience as a community pharmacist and a PhD in pharmaceutical biochemical sciences. She is also the president of the European Association of Employed Pharmacists. This leading organization represents and advocates for the interests of employed community pharmacists in Europe. Welcome, Katrina. We are looking forward to hear you.
Thank you very much for introduction. I'm very pleased that I'm here with you all today. Today we will explore how pharmacists play a crucial role in enhancing community health through preventive care and educational initiatives. Like you heard, I'm a pharmacist, but also I start my career in faculty. So my goal is to connect practice and academy. First, can we move on next slide, please? I declare that I don't have any conflict of interests. And next, what is the role of the pharmacy in community health? We, during the years, we increasingly recognized as key players in the healthcare sector, not just for our traditional roles, but also for active involvement in public health promotion and chronic disease management. This is supported by various FIP documents, which emphasize the evolving scope of pharmacy practice. You all know, I think you know the FIP statement of policy, the role of the pharmacist in the prevention and treatment of chronic disease. But I just want to highlight what I think is most important in this document. It's the role of the pharmacy in preventive care, patient education, and of course, community engagement. So on the next slide, I put the World Health Day initiative logo, and they say, my health, my right. And we want to participate. When I said we, I said my pharmacy, by participating in the World Health Day. And we as pharmacists not only enhance public awareness about significant health issues, but also underscore the essential role of the pharmacists in improving health outcomes. This involvement showcased the pharmacy profession commitment to public health and preventive care, aligned in the border of goals of World Health Organization and other global health directives. So pharmacists' role in preventive care includes the management of health screenings, and these screenings are vital for early detection of some common issues. We said it's hypertension, diabetes, which is prevalent in many communities and countries. By identifying these issues early, pharmacists can refer patients to other healthcare providers when it's necessary, of course, and provide ongoing support and counseling. It's very important. But from this slide, I want to highlight this health literacy. I think it's a hot topic because I don't know how is your country, but when we talk about Croatia, we have very low health literacy, and our patient doesn't know much about this diagnosis and medicine. So I think it's very important to be part of education in health literacy. It is crucial to empowering individuals to make informed health decisions. Of course, according to FIP, enhancing health literacy helps bridge the gap between professional healthcare delivery and community needs. And of course, everything what we do leading to better healthcare outcomes. This expand role is not only increase the accessibility of healthcare services, but also ensure holistic approach to health management. World Health Organization said that this year theme was chosen to champion the right of everyone in everywhere to have access to quality health services, education, and information. And I think in every part of this sentence, pharmacists can be equal part in healthcare system. So next slide, please. So for us as pharmacists, it was a call for action, and our proactive response to these health goals is demonstrated through screening initiatives. These screenings can improve, of course, access to healthcare, enhancing disease prevention, and increasing health literacy with our communities. You see, this picture is when we decide to go out from the pharmacy in the city center and provide measurements and education. And you see the line, it's lots of interest of people. We provide this initiative in 7 pharmacies, for urban and in 3 in rural part of the county in Croatia where I work. And this was 7-day health screening initiative. We extend this World Health Day, so we try to engage more people. So if you can, next slide, please. Our approach involved a cross-sectional study using standardized protocols and validate equipment. We conduct comprehensive health assessments, including blood pressure, glucose level, body mass index measurement, and we want to evaluate the health status of our participants. And also we provide skin problem management and education. We have one pharmacist who has a specialization in dermatopharmacy, so he is providing education about this problem. Like you see the picture before, we 1 day go out from the pharmacy and 6-day measurement provide in the pharmacy, and everybody who wants to participate was welcome to participate. We engage 304 patients, assessing a diverse group of varying educational backgrounds and marital status. But this diversity helps us understand the impact of screenings across different demographic groups. Most of them were women, and average of here is 55 years old. Okay, you can go. Next slide, thank you. We observed noticeable differences in health metrics between urban and rural place of our county. And these findings is in the line with other studies where some studies demonstrate that urban population tend to have better access to healthcare services, which often result in earlier detection and management of hypertension compared to rural places. So even is our findings similar to studies, we really was surprised with this bad situation, because most of these people who came to screening in pharmacy already have medicine for this condition. So I think here we have a pretty big problem with education. On the next slide, we can compare the blood glucose level in the morning before breakfast, and we see similar situation in urban places is better than rural places, but 78% of non-control patient in the rural place is really bad situation. Also, another relevant study from the American Journal of Preventive Medicine examined disparities in diabetes management and found that rural residents often have poorer health outcomes due to limited access to care and healthcare education. So for us is also a call to action and follow-up consultation, what we provide. I think there is critical component that ensure the continuity and care and maximize the impact of initial screening. So pharmacists provide personal feedback and advice based on the screening results. Firstly, we consult about lifestyle modification, consulting about necessary of changing lifestyle because they can improve their health outcomes. And of course, this involves dietary recommendations, education about healthy food, physical activity tips and strategies for managing stress and improving overall well-being. Of course, pharmacists take the opportunity to enhance pharmacists' understanding of their health conditions and importance of adherence to prescribed therapies. As if you can back, please, one slide. Thank you. Like I said a slide before, the most of the patients who came to our pharmacy to measure their blood pressure or glucose level already have the medicine for their condition. So we need to take more advice about medical use, the efficacy of the dosage and potential side effects. And we want to help people to understand their conditions and why it's important to take the medicine, right? So when we discuss about adherence, we use our validate questionnaire, Adherence 7. It's validated a few months ago, and hopefully next month will be published. So we use this questionnaire, what is adapted for the pharmacist. When you talk to a patient in the pharmacy, you can easily discuss about adherence and take motivate to take the medication. Of course, all this education and consultation help in building a trust and long-term relationship between pharmacy and patients. Next slide, thank you. The success of initiative show that pharmacy lead screenings are not only effective, but also essential for the early detection of potential health issues. Moving forward, of course, we advocate for continued investment in these programs to enhance their reach and impact. But also, I want to point out these collaborative opportunities, because when we go out from the pharmacy, we became more visible, and we make collaboration with GPs, hospital, public health institution in our city. And next month, we all together provide another initiative, World Sports Day, where we engaged and physiotherapist and fitness trainer, and all of us all together provide education for our patients. So I think it's really, really important. Skin health education, like I said, our pharmacist who is specialty in dermatopharmacy is provide education, outreach on skin protection among patients, and it was really big impact. Last year, we also provide similar education for our patient, and this research and results will be presented on Cape Town on AFIP Congress. In the end, I want to point out, if we can, next slide, thank you. Our work as pharmacists extend behind the pharmacy, and we are a vital part of the healthcare system, capable of making significant contributions to public health. Also, our patients are very satisfied with our initiatives. And this is a picture of my team who provide with me initiative during the 7 days and other initiatives also, but we recognized from the patient, but from our local government, and received recognition from mayor of the city and the county for what we are doing. So I thank to you all for your attention.
Thank you, Katrina. Very interesting presentation. And of course, health screening is one of the important things that we have to be also considering during our activities as pharmacists and researchers. So we have already some questions on the Q&A box, and as we have some time, I would like you to, if you can, comment on them.
Okay.
So Andy asked if you use a control group in your research.
No, because this was an initiative for everybody, because it's World Health Day. So we didn't want to make a study. We were just, this is a pilot, how we can be more involved. And now we have some experience where and when we can provide this screening. So next time when we have some initiative, we will have control groups and participants, but we then have inclusion and exclusion criteria. But in this initiative, everybody can be involved. So next time we will be like study, real study.
And doing a standardized design of the study. Sure. Luna asked if you are allowed to conduct these activities by law outside of the pharmacy.
We can when we have something like World Health Organization, World Health Day, you know, and there's a national and big day, and you can promote. But on other days, no, it's not possible today to go out and promote something. But when we have something initiatives on the national level or world level, we can.
Okay, perfect. So in the whole Croatia, you can do it in the specific days. Great.
Yes.
And we also have a question from Aslam. Aslam says, thank you, Katrina, for the important presentation. What's your opinion if the training clinical pharmacists posted at community pharmacy, can they be beneficial in medication safety and for patients' care?
Of course. In my pharmacy now, one pharmacist will be a clinical pharmacist, and I'm happy. She tried to. She will end this education, because I think it's very, very important for medical use review. Then education, what they have, it's different from, I said, basic community pharmacy. It's not it's not really nice maybe to say, but 3 years of education additional in the clinical pharmacy, it's very important for the pharmacy.
And also from Aslan, another question is, what is the role of community pharmacy in patients' adherence for special treatment regimens?
We try to engage the people to be more adhere. Like I said, we now provide a new questionnaire, Adhere 7. The 7 pharmacists from community pharmacy was involved, and academia, Faculty of Pharmacy. So we try to make a questionnaire who is patient-friendly and time-friendly for pharmacists who work in the pharmacy. So you have time to discuss with patient about adherence with this questionnaire very easy. So community pharmacies have a bigger role in that.
Okay, great. And last question that we have for now is from Emilia. Were there difference in the screening results between the patients who were screened in the pharmacy and those who were screened outside the pharmacy?
No, I just want to make this. It's very interesting for me also, but it's not a significant difference between them.
Yes. Okay, that's great. Well, for now, there's those questions related to your project, Katrina. Thank you very much, but stay tuned on the Q&A box if they come.
Okay.
And I also would like to invite again Anastasia. We still have some time left to answer another question that we have during this time. Are you there, Anastasia? Okay, if no, there's a question for you in the Q&A box. If you have time, please check on that, and we can move on to the next presenter. So our next presenter is Joan Mir. So Joan is a pharmacist with training as a biotechnologist and over 10-year experience as a researcher in pharmacy practice and biotechnology in the University of Barcelona, Instituto de Salud Carlos III, Colegio de Farmacéuticos de Barcelona, and Consorcio Sanitario de Barcelona. Joan is an enthusiastic for helping future healthcare professionals with their training and as associate professor at University Ramon Llull. So welcome, Juanmir, and the floor is yours.
Thank you, Fernanda, and thank you to all the organizers for letting us explain you today a little about the research that we have performed in Consorci Sanitària Barcelona. I would like to state that I don't have any conflict of interest. And today I'm going to talk to you about the intervention by primary care pharmacists to reduce safety drug-related problems in nursing homes in Barcelona, Catalonia, Spain. Many of you will maybe familiar with the Spanish healthcare system. It's a beverage it follows a beverage model. However, here in Catalonia, we have a mixed model since we actually have a single payer, which is the Catalan Healthcare Service, or CatSalut for short. But this institution pays different healthcare providing organizations that are not all of them completely public. All of them are managed by non-profit foundations, or some of them are held by the Catholic Church, others by local entities, such as universities or workers' unions. CatSalut's role is to ensure the quality of the public healthcare coverage in Catalonia. And it has several branches around the territory, and I've been working for a year in Consorci Sanitària Barcelona. That's the local institution which enforces the CatSalut policies and oversees all the HPOs, these healthcare provider organizations, in the city of Barcelona. That's a city of roughly 1.5 million people. To ensure the quality of the healthcare provision, CatSalut has created several indicators with objectives whose consecution is linked to a variable part of the service purchase contracts to the HPO. So it means that the budget may change one year to the other depending on the consecution of these objectives. It's a management by objectives model. There are some of these objectives are related to pharmacotherapy, and they can be affecting a single line. Maybe they affect only to primary care centers, or they can affect several lines in a transversal way, affecting hospitals, intermediate care, primary care, and as well as healthcare, mental health care centers. The two main indicators for pharmacotherapy are the prescription quality index and also the medication safety indicator that I will explain a little further. In this case, the MSI has been designed with the aim to identify potential incidents of prescription and to enhance the clinical review of the medication plan and to avoid medication-related safety issues. It includes identification of patients, elderly patients with potentially inappropriate medication, those with a high anticholinergic burden. It includes also the use of several antipsychotics, opioids, benzodiazepines, proton pump inhibitors, so in order to ensure the security of the patients. These indicators are monitored within the HPOs by primary care pharmacists who are non-dispensing, non-prescribing pharmacists that give support to family physicians and nurse practitioners. Both are able to prescribe drugs and medical devices here in Spain. And they help them to maximize the medication benefits, minimize the medication risk, and to optimize the allocated budget within the healthcare provision. This role was created in mid-1980s. However, it hasn't been fully implemented in the whole autonomous community of Catalonia here in Spain until 2024. And nowadays we have for 70 primary care centers in Barcelona city, we have roughly 20 primary care pharmacists. Okay, and the chart of services and activities has been defined this year. You may imagine that having 20 primary care pharmacists and 70 primary care centers, the patient ratio with each pharmacist doesn't allow them to interact directly with patients. So their intervention are mainly focused in population level. However, we wanted to assess if their involvement in medication reviews would help to reduce drug-related problems in nursing homes. So we started this project. We have to take into account that we have a difficulty here because nursing homes are not part of the healthcare system. Some of you may have heard of integrated care, which proposes to make the interaction with social care and healthcare a unit. However, it wasn't like this in the past. It started because of the COVID-19 pandemic. It was imperative to create this integration, and now we have a deployment plan for integrated care for people living in nursing homes, integrating both the healthcare provision, mainly focusing in the intermediate care and primary care, and the social care, because in the nursing homes we do have physicians. However, they are responsible for proposing the drugs to be prescribed, which are actually prescribed by the general practitioner with the support of the primary care pharmacist. Maybe you should understand too that we have two pharmacist professional intervening here, since we have the primary care pharmacist that helps the prescription and supervises the general practitioner prescription. And also we have the community pharmacist, which is responsible for dispensing and filling in all this medication. So our purpose was to propose the primary care pharmacist to review the pharmacotherapy within their team of at least 50% of the patients living in nursing homes in the city of Barcelona, with any of the three following sub-indicators, red flags. Inappropriate medication according to CATSA consensus criteria that was following also the Beers, start-stop, and Priscus criteria. The prescription of 3 or more anticholinergic medications regarding anticholinergic burden, and the concomitant use of urinary absorbents and medications for urinary incontinence. And we wanted to evaluate the impact of the intervention on those incidents. How we did this? We created 2 lists in May and October 2023, identifying all the chronic patients with who met any of the 3 aforementioned criteria. And we gave those lists to the primary care pharmacist to review the medication plans for these patients. And then the primary care teams had 2 options: to use what is the usual care nowadays, that's an automated tool-based review, or to perform an individual review led by a primary care pharmacist. This automated tool-based review is using an IT module that facilitates the prescriber to check whether there are duplicities, polypharmacy, and any problem that might appear regarding the medication. And what was innovative in this case was that we proposed the primary care pharmacist to lead multidisciplinary type 2 the intermediate medication review according to the Pharmaceutical Care Network Europe definition, and it was a patient-centered methodology. Okay, so we wanted to assess if there was any difference between this kind of review. So these are the results. We identified 2,000 patients, 1,400 in May and 600 in October, and we made a follow-up till December. We had an 86% of the patients were active. That meant that they were not deceased and they haven't been transferred to any other territory. So we could do some follow-up of them. And here you can see the distribution of the interventions that were performed. We had that the medication plans of the patients were reviewed in 84% of the patients, and we had 15% of them that we didn't receive a report of any kind of intervention. We had 65% of the patients were evaluated with the usual care tools, with the automated tool-based review. And then we had around 20% of the patients that had an individual review led by a primary care pharmacist. And we had 13% of them had a reported resolution. That meant that we were informed if any changes were performed in the medication plan. And we had a 6.5% of patients who were had an individual review. However, we didn't have the reported resolution. If we compare the state of this red flag, these incidents that were detected, we have that in the case of the individual review led by a primary care pharmacist with a reported resolution, we had an odds ratio of 1.77 that was statistically significant, and which meant that this intervention was correlated with the separation of this incident. So our final conclusions of these preliminary results is that any review intervention is capable of impacting these incidents, but only individual reviews led by primary care pharmacists with reported resolution achieve this with a statistically significant association. And the established percentage of 50% as an objective for the pharmacotherapy review was greatly exceeded, as we have seen. I would like to thank the team I've been working for the last 12 months in the Control Sanitari de Barcelona, and here you can find the references to all the methodology that we have been using, and I will be happy to answer any question that you might have.
Great, thank you very much, Amir. Really nice presentations, and of course, an amazing and bold project.
Thank you.
While we wait for questions, I would like to ask you about what are like the challenges or the most common challenges related to dealing with all of these stakeholders, because it's not just you doing the project.
No.
You have different agencies and spaces that you have to be in. So for you, what do you think it is?
This is actually challenging, and when we share this kind of experience within Spain, sometimes in the other autonomous communities, they don't really understand this, but it's actually challenging for any healthcare service to deal with all these HPOs, because they might have other interests, and even though we try to incentive them through the budget to follow the policies that we set in CatSalud, sometimes they might have other opinions regarding the healthcare that has to be provided. So it is actually quite challenging, Fernanda, to try to have
balance
homogeneity of the healthcare provision. But I think that we actually succeed in a way.
Yeah, of course. Yeah, we can see by your results and the work you've been doing. So what are your next steps? Like what we are going to do from now?
Right now, we have defined for CatSalud the role and the competences of the primary care pharmacist, and one of the important steps that is going to be taken is to define in the clinical practice station the software that it's used for the provision of healthcare. We don't have a specific role for the primary care pharmacist. So it is important to create this role in order to have these interventions registered in a way in order to be able to follow up what's the intervention that the primary care pharmacist is performing. Okay, and one of the things that is going to that we have been working in the past, and it's going to be implemented and enforced, is the communication between the primary care pharmacist and the community pharmacist in order to achieve better healthcare outcomes. Since one of the main complaints that the community pharmacists have is that they cannot reach effectively in the primary care centers and the general practitioners. And we have been implementing in some areas in Catalonia, including Barcelona, this role of the primary care pharmacist, that it's going to help the community pharmacists to reach and to detect all the problems regarding adherence in the patient, or all the problems that the community pharmacist can detect and we don't know within the system when it comes to access to certain medicines. We're talking about shortages, okay, for example. And actually, it's something that is interesting because I have recently heard that from the Ministry of Healthcare around Spain, they are proposing to use the same model that we have been developing here in Spain, in Catalonia, regarding the communication with community pharmacists and primary care pharmacists in order to improve this.
Oh, that's great. So something you're doing like in a way that can also help the whole country. So
I hope so. Yeah.
So we have some questions already in the Q&A box. Aslam said, thank you for the important presentation, and asked how the pharmacists work in primary care or nursing homes to ensure the rational and safe use of high alert medication.
I'm not familiar with the definition of high alert medication, so maybe if
maybe if Aslam can
because
but maybe it's related to the medications that we need maybe to take more attention on as pharmacists.
Okay, well, there are actually
regarding safety.
The thing is, we have identified, we have to take into account that all the prescription within the healthcare system, well, most of the prescription within the public healthcare system is electronic prescription. So we are able to monitor the prescriptions of all the patients within the public healthcare system, and we can detect certain ATCs and certain specific medications to red flag them, and then give this information to the healthcare practitioners to do this review. The thing here is usually the primary care pharmacist does it in a population level, okay, and then they give the information to the specific prescribers. So there's an electronic system. This part of the IT is actually really important, that allows them to detect these medications that have to be followed up more tightly.
Yeah, that's perfect. We also have a question from Luna. So did you review medications only, or also supplements and herbal treatments?
Well, we actually we only had the information of everything that was prescribed electronically, and in this case, the OTC drugs are not included.
Okay. And also a question from Aisha is, what major hospitals are included in the Catalan Health Institute network, if you know?
All of them, mostly.
All of them.
Yeah, maybe we have 2 of them that are for the private network, but we have Hospital Clínic de Barcelona, we have Vall d'Hebron, we have Hospital del Mar, Hospital de Sant Pau, and then if you go outside Barcelona, you have also Bellvitge. Well, all the major hospitals are within the public healthcare network, and even sometimes the doctors that work in the private sector are actually working to in the public sector, since the innovation are driven here in the public sector.
True. Okay. So for now, I think this is, we receive another question. So Luna said, based on your answer, do you consider that you could miss some drug supplement or drug herbal interaction?
That's right. Yeah, totally. Actually, it would be interesting to have information from the OTC dispensation, all the interventions that are given, all these drugs that are dispensed, and all these herbal supplements that are dispensed within the community pharmacies. However, that would mean to have information regarding this patient and collected within the public system. So, and maybe some people may be reluctant to do so, but it would be really interesting to have that.
True, but I understand it's really difficult to have this kind of information, as we don't know what the patient is buying by itself or where he's consuming. Or
there are some initiatives from the Barcelona Pharmacist Association that they have been proposing that, but it's not actually happening.
Yeah, I don't think it's that feasible yet, but in the future, maybe, right?
Thank you.
Okay, so thank you very much, Mir. If we have further questions on the Q&A box, feel free to answer them as they come during the next presentations. So we end now our first part of the second day of the PPR SIG virtual meeting. And before we go to the coffee break, I would like to invite Ali from FIP to tell you some news about the future events or how to become a member of our group.
Thank you so much, Fernanda, for the amazing moderation, just as amazing as Charlotte yesterday. And I would like to also thank the chair, Victoria, for pulling this up together. This has been an amazing journey for me. The preparation, also these 2 days, the attendance is incredible. So I would like to thank every single person who is willing to spend their time here, joining us, listening to us, joining with the questions, trying to forward the pharmacy and forward the FIP as much as possible. And at this point, I would also like to invite those who are interested to join us in beautiful city Cape Town in South Africa in between 1st and 4th of September 2024. It is going to be one of the most impressive congresses that we ever had. I can tell you by looking at the number of participants who are joining us, the program has been done with my colleagues. It has been prepared, and it has been like a hand-picked topics for each session. We also have great social events and activities. So therefore, I would like to invite every single one of you to join us to talk about the future of healthcare and pharmacy. And if you can go to the next slide, Hala. And at this point, I would also like to thank again for the PPR special interest group for raising up this issue that we can actually, we are offering to those who joined us for this webinar a 6 months free membership. And this comes as if you join us by scanning that QR code right now, you will be able to get the benefits of the membership this 6 months until the end of this year, plus 2025. All you need to do is to scan this QR code until the 31st of July, and you will be able to become a FIP member and get the benefits of being a FIP member and join us. Thank you so much. Now, I think there's going to be some nice music, and we will be back in 20 minutes, if I'm not mistaken. Thank you so much, Fernanda.
Hi, everyone. So let's begin the second part of our event. Before that, just to remind you, besides these amazing presentations that we had yesterday, that we are having today, we also have over 70 abstracts and posters available in the event website and in our app. So if you haven't checked them yet during the coffee break, you can do it later on or on the next few days. And you can also reach the authors to discuss the project, topics, and network. So let's start our second part of the presentations with Ivana. Ivana is a Serbian national and a teaching associate and PhD candidate at the Faculty of Pharmacy, University of Belgrade. Since last year, she has been an associate outside employment at the Chair of Social Pharmacy and Pharmaceutical Legislation. She also leads the Department of Commercial Support and Health Professional Support projects at Galinka Belgrade. And she has led professional and educational projects in the field of pharmacy safety, resilience, and patient safety. Welcome, Ivana. The floor is yours.
Thank you. Thank you very much, Fernanda. Today I will present the Galinka Academy project I lead for 4 years. And I will present our research on topic enhancing competency-based education for pharmacists, a strategic initiative in Serbia. Please, next slide. All aspects of this study, including design, methodology, data collection, analysis, and interpretation, were conducted independently. The Galinka Academy and all collaborating institutions provided resources and support without influencing the results or conclusions presented in this research. Next slide. At first, we need to start from COVID-19 and the global healthcare challenges for pharmacists. At first, burnout, second victims phenomenon, and declined responsibility for therapy outcomes. The purpose of this project is to enhance competencies aligned with International Pharmaceutical Federation's goals and global competency framework. Key goals of this project: organizational management improvement, professional skills, and personal resilience improvement. We covered 10 goals from 21 goals, goal 2, goal 3, 5, 6, 4, 8, 9, 19, 20, and 21 for sustainability in pharmacy. Please, next slide. This project is created in collaboration with University of Belgrade Faculty of Pharmacy, EduMed Association for Continuous Medical Education, Singidunum University, and Galinka AD, Belgrade Pharmaceutical Company. Multidisciplinary team, including business consultants, academia professors, and pharmacy practitioners, according to a global competency framework and guidelines for healthcare interventions, educational interventions. This project included webinars via online platform, WebJam Webinar Jam online platform, accredited tests for license renewal, and courses via Gulliver's mobile application. Content is created and developed to enhance critical competencies, human resources management competencies, interprofessional collaboration, and leadership development. And this project is delivered through accessible online platform, and after that via available free of charge mobile application. Next slide. In this table, you can see topic of accredited tests, competence group, and competencies. Some title of these topics are pharmacy as a business system, time management in pharmacy, team management in pharmacy, performance management in pharmacy, healthcare professionals, teamwork, decision-making, business negotiation, risk management, healthcare professionals, communication, research in pharmacy practice, second victims in pharmacy, resilience in healthcare, burnout syndrome in pharmaceutical practice, and quality and safety in pharmacy practice. Competence groups, organization and management, and professional personal competence group, and competencies, human resources management, interprofessional collaboration, workplace management, communication skills, quality assurance and research in the workplace, and leadership and self-regulation. Next slide, please. Here we can see results. We started in 2021, and these results include results till the end 2023. Around 6,000 pharmacists at that moment engaged from 2021, 10,427 webinar views, and 5,351 accredited test access. Effectiveness, 78% success rate for accredited test. We conducted 4 business forums around on-site business forum for 30 managers and human resources business partners, around 35 webinars on different topics according competence framework, and 15 tests for license renewal. Focus on these business forums is on relationships, effective relationships, leadership, performance management, employee development, and change management in pharmacy practice. Next slide. For sustainability of Business Academy and for cost effectiveness, we created a mobile application available at the mobile application stores, completely free of charge for all healthcare professionals, pharmacy healthcare professionals, community pharmacists in Serbia, with restricted access only for certified pharmacists with a working license at this moment, working in community pharmacy. This application is 24/7 available with webinar recordings, links to accredited tests, and some kind of video materials. And we have user feedback at this moment with satisfaction score 4.75. And we conducted online survey, some kind of happy sheet, and self-assessment of competence improvement, and we have result of 95-77% reported enhanced competencies with this mobile application. Next slide. In conclusion, we can say that we have significant professional growth aligned with global standards and local needs. In the future, we plan some kind of enhancements, refining educational content and expanding models to cover additional competencies. Overall goal is to support professional development and improve healthcare outcomes in pharmacies in Serbia. And we want in future, we want to make some kind of gamification in this application, something similar as Anastasia presented at the start. And we want to measure impact on pharmacy business and pharmacy practice outcomes for patients. And we want to measure how these educations impact staff turnover and general satisfaction in pharmacies. And next slide. And I want to acknowledge to all contributors, including academic experts, the Pharmaceutical Chamber of Serbia for accreditation of this education, and all participating pharmacists. At this moment, around 55% of pharmacy community in Serbia participated in some kind of education, and I want to appreciate special thanks to Galenica technical and educational teams for their dedication to the project success. Thank you. You can see my contact and scan QR code, and we can connect at LinkedIn and maybe have some kind of future research collaboration. Thank you. I'm available for questions.
Thank you very much, Ivana. So really nice presentation. And once again, we are talking about education. As you said, Anastasia already reached the topic at the beginning. Yes. And this is a different perspective, really interesting work. So before we start with the other questions, I just have one. So these numbers that you have are all across Serbia.
Yes, only in Serbia. Yes,
yeah, but the whole country.
Okay.
The whole country. Oh, wow, this is amazing, because you started in 21, right? And you already
we started actually in 2020 as some kind of pilot, but officially in 2021 with academia and consultants, and we started this big project with accreditation.
That's great. Yes. So we have already 2 questions. First of all is from the first one from Luna. She mentioned you rely on the self-assessment of the participants and not a pre-post evaluation, right? So measurements of efficacy of the interventions rely on participants' point of view.
Yes, correct? We measure the participant point. This is a Kirkpatrick evaluation. First level of Kirkpatrick happy sheet, and we have a happy sheet satisfaction of our participants, but we have a success rate for these tests. They learned, and after that they assess tests, and we have 85% of success rate for this test. This is the first step. I said in future we plan to measure impact of this education on staff turnover, on satisfaction of pharmacists, on patient outcomes, and business impact. We want to effectiveness of this project for business, because we had conducted a business education, and we want to measure that impact. At this moment, we have just happy sheet and the success rate for accredited tests.
And do you have access to the profile of the people? So I don't know if they provide this kind of information, to say if they are young students, pharmacists, or they are older, female, male?
Yes. We have a profile, but these educations are conducted via mobile platform, and this is a third-party data protection. We don't we can't share all these data, and at start this was a project from industry, and we at the next level we started with academia research, and it was not planned at start to be research. It is planned to be real-life project, industry support for pharmacists, community pharmacists in Serbia. Yes.
Great. And we have another question from Aslan. He says, excellent presentation. Would you like to share what measure apply for concluding the results after the webinars attended by the pharmacists in your program?
Would you like to share what measure applied? Happy sheet, Kirkpatrick, the first level. happy sheet for webinars, and for accredited tests. We have accreditation in our country, legislation with Health Council of Serbia, and we have legislation for accredited tests. Pharmaceutical chamber have more data about this test. And as I said, this is not started as academia research. This started as a project for practice, and after that we started some kind of research with this project.
Okay. So if we have more questions on the Q&A box, you are free to answer them, Ivana, in the next
yes, we have a
minutes.
satisfaction known model. I can send you a link about Kirkpatrick evaluation for business education, and this is validated model for education evaluation. And Kirkpatrick have 4 levels, and fourth level is this which we want, and to measure impact on business and staff turnover and cost effectiveness of this project. Yes, it is validated. I can send you a link about Kirkpatrick validated model for education evaluation. Okay.
Thank you, Ivana. Thank you very much. So the ones that are interested on the project can reach out to Ivana, or you can still send questions on the Q&A box, and I know that you'll be glad to answer them. So let's move on to our next presenter. I would like to invite Chi-Han to present the work. So Chi-Han is a PharmD candidate at Albany College of Pharmacy and Health Sciences in Albany, New York. She has a Bachelor of Science in Public Health and has recently completed an advanced pharmacy practice experience at Showa University in Tokyo, Japan. She has an interest in global pharmacy practice and wants to work within an administrative leadership role to shape health systems. Welcome, Chi-Han. The floor is yours.
Hello, thank you so much, Fernanda. Good afternoon, good morning, good evening. I'm very excited to be presenting to a global audience today. My name is Se-Han Jang. I am a PharmD candidate in my final year at Albany College of Pharmacy and Health Sciences in Albany, New York. Next slide, please. First, I'd like to state that I have no conflicts of interest to declare. Next slide, please. So in my work titled The Preliminary Scoping Review, a Pharmacist Review, Pharmacist Role and Contributions in Public Health in South Korea, I aim to explore the pharmacist's role in public health. And in my initial findings, I found 3 main documents that were important to my research. So the first document was from the World Health Organization, titled The Role of the Pharmacist in the Healthcare System, a report of a WHO consultative group. And this was from 1988 and 1993. This was one of the first documents that covered what the pharmacist's role is in public health on a global level. As you can note, it is a little bit dated, coming out before the 2000 year. The next 2 documents I found had a more US focus, but were important in guiding my research. The first one was from the American Public Health Association, APHA, titled The Role of the Pharmacist in Public Health. This document was important as it outlined 6 policy proposals for what pharmacists should do to get more involved in public health. I didn't get to list them on the slides, but I will kind of give you a brief overview of the 6 proposals that were included. The first one was about supporting greater inclusion of public health concepts in the curricula of schools of pharmacy. The second one reiterated the need for increased awareness of the role of pharmacists in public health. The third one encouraged the transdisciplinary collaboration of health planning agencies. The fourth supported the influx of more pharmacists trained in public health. The fifth one encouraged the government to recognize pharmacists as healthcare providers. And lastly, the proposal encouraged the participation of pharmacists and other public health professionals in transdisciplinary research. The next document that was important in my initial background research was by the American Society of Health System Pharmacists, titled The Role of the Health System Pharmacist in Public Health. In this document, they outlined how pharmacists can intervene in patient care, such as primary, secondary, and tertiary interventions. It's a very basic public health concept that I'm sure we've all heard of before, but I use those categorizations to help guide my research. And I chose South Korea as my first country to focus on for my research topic due to my own personal background as a Korean American and due to one of my collaborators who is a working pharmacist in South Korea. So I thought this was a good place to start. So overall, my purpose was to conduct a preliminary scoping review of pharmacist roles and limitations in public health initiatives in South Korea and identify pharmacy contributions to improve public health. I also want to note that while I was doing my background research, I realized that there was a great lack of public health research of pharmacist practice, especially specifically by country and in South Korea. So this is what started my research. And to do this, I did an environmental scan. I first looked through journals and search engines such as PubMed, Scopus, ProQuest, and aimed to examine articles from global clinical journals, such as the Korean Journal of Clinical Pharmacy. I guided my research by using mesh terms such as those listed here, such as public health, population health. I look specifically for outcomes and focus on South Korea. Initially, I scanned through 203 articles, and I narrowed it down to 23 articles after a full abstract review. While I was reviewing the abstracts, I was scanning for the clinical, economic, and humanistic outcomes of pharmacists in South Korea. I had to exclude articles that were irrelevant to my research objectives if it was not related to initiatives within South Korea, and if there are any language limitations where the abstract was not available in English, or if there were duplicate articles. After collecting these articles, I categorized them per the APHA 6 policy resolutions and selected a couple that were the most relevant to that abstract or article. And I also categorized each article by the health prevention stages of primary, secondary, or tertiary as outlined by the ASHP document. Next slide, please. So initially, going into my research, I knew that there was not going to be a lot of research or articles available that was pertaining exactly to the pharmacist's role in public health in South Korea. However, this was an initial scope, and of the 23 articles that I examined, I found that policy numbers 2 and 3 from APHA were the most common. Just as a reminder, the second policy was about reiterating the need for increased awareness of the role of pharmacists in public health in South Korea. And number 3 was about encouraging the transdisciplinary collaborations of health planning agencies. Out of the health interventions, the secondary form of intervention was the most common. After looking through my results for the articles, I found that the pharmacist's role could be divided into a community and hospital setting. Within the community setting, you found the traditional dispensing responsibilities, the counseling responsibilities of pharmacists. Pharmacists also were able to provide medication reviews and reconciliation and address any adherence issues when they arise. In the hospital, pharmacists provided medication interventions for patients. They were part of groups and were relied upon by other health providers to provide recommendations or advise on medication selections for patient care. Patients also had the responsibility to report or help manage adverse drug event preventions. And of note, pharmacists were relied to provide answers to drug information inquiries. In South Korea, in the articles, it was noted that this was an increasing occurrence for the pharmacists in the hospital setting. The pharmacist benefits listed in public health, optimized medication use processes were noted, improved health outcomes for patient interventions was another benefit, and there was economic cost savings. In terms of limitations, there are regulatory restrictions, time constraints and counseling space shortages in the community pharmacies, insufficient interprofessional collaboration, a lack of financial compensation for care transition and recognition as practitioners, and there was a limited awareness of practice scope that limited some pharmacists from practicing to their full potential. And here on the bottom is just a sample of my research. I organize all my articles into a tabular format to extract the main points and points of impact of the pharmacist in public health. Next slide, please. So after my initial review, I found that in South Korea, pharmacist practice within public health is limited to traditional responsibilities, such as dispensing and counseling. However, I found that there was a potential for more developed roles contingent to technological developments, changing healthcare systems, and societal needs. This includes things such as disease prevention, where pharmacists can help intervene with smoking cessation, public health promotions, which includes patient education, patient literacy, and the development of pharmacy services, such as more awareness of the fact that patients are allowed to bring in their medications to the pharmacy for medication reviews or reconciliations, or just to have any questions answered about their care. Another point of development was the development of interdisciplinary roles, where the pharmacist is to be given a more permanent role with the medical teams that will establish the pharmacist as an integral member of the care team in institutions. And I found that we need more pharmacy education focused on communication, collaboration, and professionalism to emphasize the public health role of pharmacists. So with more education for pharmacy students and professionals through a public health lens, it will help focus to improve public health emphasis as pharmacists. And this connects directly to the APHR resolutions related to interprofessional collaboration, patient health literacy and education, and profession recognition. I just want to mention that this abstract work is part of an ongoing research effort. I am covering more expansive countries for holistic understanding, including those in the Western Pacific region and Southeast Asia region per the World Health Organization classifications. I'm continuing to collect articles pertaining to the pharmacist's role in public health, including South Korea. And I'm collaborating with other team members to gain a comprehensive understanding of pharmacists' role in public health globally. Finally, I would like to acknowledge my collaborators and supporters, Dr. Trong from the University of Maryland Eastern Shore and Dr. Rhee from the Ewell Women's University in Seoul for guiding me through my initial research and continuing to support me as I research the other countries in our very wide world. And thank you all for your attention.
Great presentation, Shihan. Thank you very much. Very enlightening. We already have one question from Diane. She says, great presentation and delight to see increasing focus on the role of pharmacists in public health. So you mentioned you start with South Korea, and she says, what is planned to next country or countries? I think you already mentioned by the end of your presentation. But she also says you have done a similar project. We have done a similar project in the UK. Colleagues in Australia are also working on this.
Yes, I just want to expand. So after South Korea, I've started my research on Japan, Thailand, and Malaysia currently. I chose these countries because when I was in Japan for my advanced pharmacy practice rotation, not only did I get to connect with pharmacists and students from Japan, but I was also able to meet with students from Taiwan and Thailand, and even from France. So again, it was really good to listen to all the pharmacists and pharmacy student experiences within their community pharmacies, their hospital settings, and learning about these different health systems that will give me a more comprehensive and solid background in my research moving forward. And I did focus on the Asian region of the world, not only because of my personal interest, but also because I realized that the concept of public health is something that we talk about often within the US, at least from, I guess it's a little biased since I am from the US and that is where my education is from. But with my experience in some Asian healthcare systems, I realized that the concept of public health may not be as apparent, even though they are doing roles and fulfilling responsibilities that pertain to what our public health objectives are. So I do look forward to hearing more about other health systems around the world. I love talking to pharmacists and connecting with those and exploring different health systems.
That's great. And Diane, she says she's very happy to collaborate if helpful. So maybe you can connect later on and discuss future projects.
Okay,
really
thank you so
interesting.
much.
I also have one question. So before you started the project, were you expecting this kind of results regarding the role of the pharmacists only on traditional responsibilities, or hopefully you were thinking you find different things?
So when I initially started my research, some of the more apparent responsibilities, such as dispensing and counseling, were expected. I know that we all as pharmacists share certain responsibilities and roles across the country. So I was not as surprised about those results. And the more I researched, what did surprise me was the pace of development. In the US, I know that public health and pharmacy is something that has been growing within these past couple of years. We do have a focus on what the pharmacist impact is, how we interact with our health systems. And I noticed a similar development in South Korea as well, where they're starting to recognize what the pharmacists can do for the systems, what their benefits extend to beyond just the pharmacy dispensing role. And I thought that was very interesting. And talking with other students, going outside of just my South Korean research, I noticed that we were kind of running into similar problems in other countries, such as with pharmacy burnout or kind of the expanding role of pharmacists. One point of public health initiative that I like to talk about was the pharmacist's ability to immunize. I know that not in all in all countries, pharmacists may not be allowed to immunize, or the regulations are different. So I thought that was a good starting point for a public health conversation for pharmacists to start off with. And again, making these comparisons, I always find something new about how different health systems operate on top of the country's own culture that can and really influence the practices on top of like local government regulations that kind of have an impact on how we can practice as pharmacists within public health.
Right. Yeah, I agree with that. And I also would like to ask you, so after you finish like the scoping reviews and to ground all of this evidence, what do you like to do with it? Do you have any plans for the future after you find all of the results and you compare all of the countries, etc.?
I do hope that we finish looking through all of the countries in the world. It'll be some sort of process, but at the end of it, with the data that I have, I think it'll be nice to have a comprehensive review of where pharmacists are at in terms of public health practice. Because as I stated, that even though some of these findings may be very obvious to some practitioners, there was a lack of formalized data and research material that was available online. So I think having a comprehensive compendium of data is going to be useful instead of base foundations for how pharmacists can influence public health or practice within it moving forward. And I think having that shared dialogue will give other countries the common ground to develop our role further as providers, as healthcare professionals, and really contribute to our health systems around the globe and be able to implement these new findings within our own countries.
That's great. So looking forward to see these results in the near future. Thank you very much once again, and stay tuned if we have further questions on the Q&A box.
Okay, thank you.
Thank you. So let's move on for final presenter of the day, Ini Mouvier. She's a registered pharmacist with the Pharmacist Council of Nigeria and a clinical pharmacist with a Master of Science in Clinical Pharmacy and Pharmacy Administration from the University of Ibadan, Nigeria. She's also affiliated with the Department of Clinical Pharmacy and Public Health in Ekiti State, Nigeria, where she's lectured. Welcome, and the floor is yours.
Thank you, Fernanda, for that very kind introduction. So I will be sharing my results on research I conducted in 2023. I was studying opinions in Nigerian University on the formal implementation of interprofessional education in pharmacy education. Next slide, please. Next slide, please. Oh, okay. I would love to declare that I have no financial or personal relationships that could inappropriately influence or bias the content of this presentation. and also that all information and research results were objectively conducted and there were no affiliation, financial interest, or significant relationships that could be perceived as a potential conflict of interest. Next slide, please. So I'll go through what interprofessional education is and give an overall background of my study with research objectives, methods, results, limitations, and then conclusion and references. Next slide, please. Next slide. Okay, so interprofessional education has emerged as a crucial approach to healthcare education in recent times, and it has emphasized the importance of healthcare collaboration in improving patients' outcome. As defined by Reeves et al. In 2016, interprofessional education is an adaptive learning environment with at least 2 health or social care professionals. Similarly to Reeves' definition, the World Health Organization framework defined interprofessional education by emphasizing that it's not only in a formal setting, so it can be in an informal setting where it happens between 2 or more different healthcare professions where they collaborate and learn from, with, and about each other. Next slide, please. So 2 notable works that have been conducted on interprofessional education are the World Health Organization framework on interprofessional education and collaborative practices, which was published in 2010. And this framework guides educators and policymakers towards developing effective interprofessional education practices. And the construct identified 5 major elements that should be embedded in any interprofessional education practice. And those elements are, number 1, it should provide team-based approach. Next, it should be patient-focused. It should promote patient-centered focusedness. And also the activities should be active learning strategies, and it should give the opportunity to learn from and with other healthcare professionals, as well as collaborative leadership. Similarly to this is I'm still on the Lancet report of 2010, interprofessional education. So they recommended like 5 major vital competencies for interprofessional education development, and those are communication, leadership, teamwork, collaboration, and patient-centeredness. Next slide, please. So during my undergraduate year, I was admitted into the Bachelor of Pharmacy program, and that program was devoid of extensive clinical work. And over time, although during that period, some universities in Nigeria still had started the Doctor of Pharmacy program, which is a more extensive clinical pharmacy work. This over the course of time to this period, the National Universities Commission, which is the NUC, has accredited over 120 universities, and they are fully practicing the Doctor of Pharmacy program now. And it is because of this increasing pharmacist role in healthcare education that has necessitated this curriculum change. And this also highlighted a lacune in our collaborative skills with other healthcare professionals, hence the need for interprofessional education. So I forgot to mention what interprofessional education is not. And this is because learning together with other healthcare professionals, taking courses together with other healthcare professionals is not interprofessional education. Interprofessional education has to do with interaction, having full focus and full implementation into patient-centeredness and getting one-on-one interaction with your patients and being involved in patient healthcare. So that is what interprofessional education is. During the course of my study, I realized that there was a dearth on literature on implementing interprofessional education in Nigeria, and this necessitated this study. So we had to sample opinions of students and lecturers on their perception and attitude towards interprofessional education. Next slide, please. Okay, so Specific objectives would be to assess students' attitude and perception on the formal implementation of interprofessional education, and also the lecturers' knowledge, attitude, because they would be co-educators for this learning strategy. Also, the stakeholder opinions are also very important in implementing interprofessional education in any university setting. Next slide, please. So the method for this I utilized for this study is a perspective cross-sectional mixed method approach. It's pretty much wordy to say out, but then it just means that I used, there was a qualitative aspect of the work and there was a quantitative aspect of the work. Before we commenced, we applied for ethical approval from the university's research and ethics board. And the three major professions of interest were pharmacy, nursing, and medicine. And this is mostly because medication use is an interprofessional activity, and the pharmacists, nurses, and medicine profession are more or less like forefront when it comes to medication use. It spanned between a period of February 2022 to January 2023, and data collection involved descriptive and inferential statistics. Also, thematic analysis was utilized for the qualitative aspect. Next slide, please. So for the quantitative aspect, we'll utilize two validated questionnaires. We have the readiness for interprofessional learning skill, which was developed by McFadden and was adapted for our clients, and that was used to extract information from students. We also have utilized the interprofessional knowledge and attitude skill by Hindera et al. In 2016, and that was used to get extract information from lecturers. It was also the questionnaires, since they were adapted, they were pre-tested, and we had the Cronbach Alpha skills and scores as displayed. For the qualitative aspect, it consisted of a semi-structured interview with 10 specific open-ended questions. Next slide, please. Next slide. Okay, so this result is showing it shows the distribution of the participants. So we had a very good response rate. We had a total of 369 students out of, I think it was about 390. And then for the lecturers, we had about 25 lecturers in total, and then 22 lecturers responded. Next slide, please. So this slide shows us the students' overall perception of interprofessional education on the left side of the slide, and on the right side, it showed the students' the prior interprofessional education experience. And it was very interesting to see that although 23% of the students have had prior interprofessional experience, there was a fairly good amount of positive perception of interprofessional education. And these results were similar with studies that were conducted in Ghana by Kwati et al. In 2020, and then Oba Gabriel in 2022 in Saudi Arabia. Next slide, please. So this next slide shows the lecturer's knowledge, attitude, and perception of interprofessional education. And this study finding was one that was very, very interesting, because although lecturers showed very good attitude and knowledge of what interprofessional education is, the perception for interprofessional education was, they had a very high negative perception of interprofessional education. And we realized that this was a statistical, when we did across analysis, we realized that the relationship between the discipline and their overall perception was statistically significant, meaning that lecturers who were in the departments of pharmacy and nursing had more negative perception of interprofessional education when compared to lecturers in medicine departments. It was in this study we also discovered that majority of lecturers in the medicine profession, they also took clinical roles. They undertook clinical roles in the hospital. So that could also account for why they had higher positive perception. Next slide, please. So on the highlights of the stakeholders' opinion, we had four overarching teams, and that is teamwork and collaboration. We had role clarification, barriers to implementing interprofessional education, and requirements for interprofessional education. So one of the major theme was role clarification, and stakeholders indicated that role clarification is a very essential prerequisite when you want to implement interprofessional education. Reasons being, as I mentioned earlier, medication use is an interprofessional activity. And so you might not be able to draw a clear, distinct line for where the doctors come in, the pharmacists come in, and the nurses come in. So their opinion was that there should be a standardized role clarification, so different professions don't encroach. They know their boundaries when it comes to patient care and advice for medication use. Next, another bone of contention was when should interprofessional education be introduced. So the essence of this was to implement interprofessional education as part of the curriculum, the current curriculum of the PharmD program. But then majority of all the stakeholders were of the opinion that interprofessional education should be introduced after undergraduate. And one of the major reasons was that the students will appreciate interprofessional education more during postgraduate level than during undergraduate level, which is still a thing of debate. So some of the barriers that could be faced are curriculum differences. The transition from Bachelor of Pharmacy to Doctor of Pharmacy has come up with a wide variety of curriculum, increased clinical activities. So curriculum differences from pharmacy to nursing and medicine as well, the professions could be an issue or could cause a form of resistance when implementing interprofessional education. Also, institutional constraints. So interprofessional education might not necessarily have to be formal as defined by Reeves. It can be informal as well. And informal way of implementing it would be maybe taking the students to ward rounds in a hospital. And for universities who do not have hospitals affiliated with them, it would cost the institution resources to convey students and bring them together in that umbrella to learn from and with each other. So those are some of the barriers that were sampled. Next slide, please. So in generalizing this result to other universities in Nigeria, I would say that a little bit of caution should be used because of the small sample size and also the fact that there could be response bias and the healthcare professions used were just nursing, medicine, and pharmacy. So caution should be used when generalizing this results to other climes and other universities in Nigeria as well. Next slide, please. In conclusion, I would like to say that although few students had prior interprofessional education experience, they showed favorable attitude and perception of interprofessional education, but there might be a little bit of resistance when implementing because the educators, which are the lecturers, have negative perception. So with that, we would advise or recommend that faculty development and collaboration should be made available for lecturers to know what their concerns are with implementing interprofessional education, and that could be adjusted before interprofessional education can be implemented. Also, there could be standardized core curriculum components in the different disciplines to make room for that intentional collaborative learning. Also, flexible scheduling and curriculum integration and support from institution and commitments would also go a long way in implementing interprofessional education. And with that, that brings me to the end of my my presentation. Next slide includes the references I have for the works. And if you have any questions, I am open to answer them to the best of my knowledge.
Thank you, Nuvier. Very interesting presentation. And again, we are touching the topic of education, this time collaboration, interprofessional collaboration. So we can see that it's a very important field that we can provide further work or further evidence on. So while we wait for some questions on the Q&A box, I would like to ask about what you proposed by the end of the standardization of a core common curriculum. So for that, with common components, what do you think would be the next steps?
I'm sorry, I didn't get your question correctly.
Yeah, so you proposed at the end to one of the solutions could be standardize a core curriculum components in Nigeria. So for that, what do you think would be the next steps to reach this outcome?
Okay, so first of all, I think the very first step would be probably an institutional-based dialogues with stakeholders, and that would involve maybe deans of faculties and policymakers to see how this can be organized and a way that we can arrange, even if it's in maybe the final year, because in the final year is mostly the clinical year for all students. So if we could get something like a seminar session where pharmacists, nurses, and medical students come together and share insights on practice-based questions, that could also help. But before that can even start, we need to talk to policymakers and see if that's even feasible in this climate.
Yeah, of course. Still have some step before that, but will be maybe in the future something that we can hope for. And regarding your project, what were for you the biggest challenges or difficulties that we had?
Thank you very much for that question. Okay, so getting the stakeholders was one of the difficult challenge because it has to deal with individuals. So scheduling times and appointments, and it's something that I didn't want something over the phone. I wanted a personal, so I could read the verbal and non-verbal cues as well. So it was really difficult getting the stakeholders and getting the interview done. So I would think that would be one of the challenges, the major challenge I had. So,
yeah, I think managing with people is always difficult. And of course, with professionals and stakeholders is even a higher challenge. Okay, so people are saying great presentation and congratulating you for your work. And if we don't have any further questions, I would like to finish this session and thank again for all the speakers and presenters for the great presentations from yesterday and from today. And would like to ask Victoria to wrap up this event. Thank you very much.
Thank you very much, Fernanda, for moderating this interesting session. And thank you again to our wonderful speakers. Today, we had the opportunity to listen to excellent researchers across the world, including Korea, Serbia, Croatia, Spain, Nigeria, Russia. And I hope you have enjoyed them. It is extremely exciting to see the large topics covered, including gamification, medication reviews, competency-based education, pharmacist roles, prevalence of drug-related problems, or interprofessional education in different settings where pharmacists can practice. And this research is key to contribute to the advancement of the pharmacy profession across the world. Please, again, do not miss the opportunity to check the e-posters, which are available on the event's website and through the app. Again, more than 70 posters have been received. They include the contact details of corresponding authors, and we have already seen email exchanges and potential collaborations through interactions in the chat box, and we encourage you to continue doing so while the posters are available. As a final note, certificates of attendance will be provided by early next week, and the best presentation and poster awards will also be announced. And finally, I would also like to thank the FIP staff for their amazing support and the efforts invested in the organization of this session. So thank you very much. Thank you for your participation, and we hope to see you again in our next face-to-face meeting in Copenhagen. Bye.